Hey folks, Ashley here, allthingsashley.com. I want to talk just briefly today about taking photos. I've been doing this for a couple of years now, daily, and I've learned a lot of tips from a whole bunch of folks, shared a lot of nice experience. So we're going to briefly walk through, say, the initial experience of taking photos with your patient. So the first thing that we typically do after your examination is we'll take them to a background. Now we have a black background. We can also flip this, and it's a blue background. And the reason why we do this is because we do a number of We do a number of presentations, and it's easier to crop the picture of the patient when there's a background, a black background, compared to the dental chair. So it makes it easier for presentations. So we're going to be using my resident contemporary, Dr. Insani, and I'm going to show you just a few little tips that I've been taught and Dr. Insani's been talking about just as between takes. I'm going to be using my simple G11 camera. Of course, these are basic photographic principles, not advanced. And if you have a different camera, I hope that they will apply. In this position, we get the patient to stand in front of whatever wall or inanimate structure you'd like. And Dr. Insani was talking about where to get the patient to look, whether it be at the horizon or pretend there's an image. You can also direct them to move their head in any way you want. So the first image you're going to get is sort of that I'm just a plain neutral face, and I know now after a couple photos I need to angle my camera at a different angle to prevent any glare off his glasses. So I don't need his whole body, perhaps if you want that in your presentations or your photos, but we do want to get closer up. Remember, we don't want to, so you see we have a bunch of glare there, we want to remove that, so I'm going to angle up. Of course, as I angle up, that changes the whole perception of his face. So it's sort of a balance of everything. We'll take one down here. That's a nice photo. Now we'll get the patient to smile as big as you can. It's really tough to get patients in their natural smile. He has a great smile. That's a nice photo. I'm going to get a bigger smile with my macro lens, and we'll do that in the chair. So I'll get you to turn to your left. So to get a profile photo, which we do use during our presentations and also for our orthodontic part of our residency, we get the patient to imagine they're facing a mirror, and for some reason that gets them to stand perpendicular to us. So just move a little bit forward. One of the things is to keep them within the black region if you're using a black screen, because as you take a photo and you clip it, it becomes even more difficult. I'm just going to grab that. And one of our orthodontic mentors suggested that one of the best photos he has in a profile is when the patient's smiling. Just give me a big smile for me. You just laugh on your own, I love it. Okay, that's good. So we can also do a number of other photos, but these are our basic photos that we'll use in front of our black background. Now we're going to switch to the chair. Okay, so here we are. Typically, you can have your patient seated any way you'd like. I find that having the patient supine simplifies the photographic procedure. And another little tip that I've learned is using a water bath to place your mirrors in. So that will warm them up. And if you don't have a dental assistant or you've tasked them to do other things or whatnot, this actually keeps the mirror warm. You can see it's just warming up there. So you can take a number of intraoral photos without having fog. You'll notice I've seen enough journal articles now, literature articles to see that the mirrors are fogged. Additionally, you can have your dental assistant or someone blow air on the mirror. That also helps if you don't have the water bath out. So some of the mirrors and retractors that we have available, there's a wide range, but some of the basic ones that we have are just different shapes for different procedures. This would be like an occlusal. This would be, say, a buccal shot. This is also for a buccal shot. There's different types. I have a titanium oxide coated one. These are chromium. They all have their different little prices and costs and touted benefits. And retractors. You got this square wire frame. You've got the plastic cheek retractors. These ones, they're a little more concave because they attempt to pull the cheek back even further, and you have a whole range of sort of automatic cheek retractors. Okay, so now we have the patient laying back, supine in the dental chair, and typically what I do, everyone has their own different ways. They have their dental assistant to retract. I get the patient retracted, just give them retractors. He knows how to place them in, but some folks, obviously the first time they don't know how to. And we're going to play, you can play with the positioning of the retractors and a whole different little things. I'm just going to show you what I've come up with. So the initial shot, what we're going to do, and you can change the angulation. You can see on my camera here, and typically I have one hand with a glove and the other one is on my camera, and I use the one hand with the mirror and retractors. So in this technique you can see that I'm just going to focus in and grab my photos, and I can zoom in and out. Of course, if you have a larger camera, it's totally different. These are just really basic photos. So what we're looking for is just to make sure that some folks at the beginning get the patient to bite down. Some folks get them to, can you just slide your jaw forward? Just bite down, slide your jaw forward. Protrude all the way to their edge to edge. There we go. Some folks get edge to edge photos for more aesthetic shots before and after. You can see how we're getting glare on some of the central incisors, so you can angle different angulation with the light change. I mean, if you have a more expensive camera, you can, or you're more advanced. If you're more advanced, you probably aren't listening to this. So the next shot, what we're going to do, just bite down for me regularly. The next shot we're going to do is we're going to do our buccal shots. Now, one of the tips that we've learned is, hold on. This is it's taken me 2 years to learn how to say this. This is what I try to tell the patient. We're going to keep the retractors in. You hold on to your left hand. I'm going to take the right one. See, he took it out too. Just let go. We're going to keep the retractors in. There we go. You hang on to the left one. I'm going to keep the right one. There we go. So now I have control over this one, and we're going to do a right buccal shot. So just keep your head straight. Relax that retractor so I can pull your cheeks all the way over here. Just keep relax. Let go even more. Okay. So you can see how now what I'm looking for is I'm looking for a right buccal shot, and what our ortho mentor suggests is we're looking to go from our canine, the maxillary left canine, or our lateral incisor, and get that buccal corridor you can see there to the first molar at least. And I'm going to take a few angulations, and one of our other mentors said the key to great photography is taking lots of photos, because it changes. And of course, with the different at more advanced settings, you're going to be looking at your histogram. I'm going to take this one, and in my case, again, the basics, I haven't found that necessary or helpful, probably because I'm not advanced, but this is for just learning. So the next stage, so we've grabbed our buccal shots, we've grabbed our straight on shots. Now what we're going to do is use a mirror. So like I said before, I placed it in the hot water bath. You see we've got a whole bunch of water stains, water spots. I'm just going to use surgical cloth wrap just to dry it off. Make sure we don't have any water stains on it, and it's warm, so just open big for it. We'll keep those in. There we go. Just open for me. So I'm just going to slide this. Just keep your head normal. There we go. So you can see now things we're looking for. Don't go quick on this. Now because it's heated, I have a little bit of time, so I'm trying to make sure I have the right angulation. And with this camera, it's going to be different with every other camera. That's the shot that I'm looking for. You can zoom in, obviously. The key is to make sure that you see everything without the lips. Sometimes if you have an edentulous portion on the anterior, one of the tricks you can do is just have the patient, okay, we're going to hang on to the retractors, we're going to keep them like a smile, so it automatically gets them to pull the cheeks and lip superiorly. So again, we'll take another photo here, trying to make sure that I grab all of the teeth. And same with the mandibular arch. So what we're going to do is I'm going to just get you to turn those down like a smile, and you see how it opens up and it pulls the lips away from the mandibular teeth. It's a neat little trick. Just open big for me. There we go. My mirror is starting to cool down, so let's just grab a quick photo here. And these are very helpful for treatment planning, as Dr. Saini and I know. You can walk away and then be able to treatment plan the patient afterwards. Okay, so that's that with the retractors. I'll take that from you. Okay, one of the last photos that you can, we've actually been questioning it, is lips in repose. So lips in repose is sort of just getting the patient just to relax and open their mouth, or open, what would you say, open their mouth?
Just relax.
Just relax, and you want to see how much maxillary anterior tooth show you get. And then you can zoom in, use your macro lens. And this is just an aesthetic. So this is called lips in repose. Just get the patient to open a little bit, just relax the lower jaw. And now what we're looking for is how much tooth display does a patient have when they're just relaxed. Additionally, so we were talking about the different types of mirrors. Now it's important to safeguard your mirrors. You place them in a surgical cloth, whatever, wrap them or whatever. But because what happens is with time, if they're just thrown in packages, you can see this one's all scratched. Versus this one that I've had for a year, I've tried to maintain it as best as possible. My wife would be surprised. You can see the subtle difference in the different coatings and the reflection. Now, maybe you might not be able to pick that up in the camera, but in real life, there actually is a difference. You can almost see through this mirror. Just for your understanding. So I hope that helps.